Hello. Spondyloarthropathy, or spondyloarthritis, is a name given to a group of joint diseases. These include ankylosing spondylitis, psoriatic arthritis, reactive arthritis, and enteropathic arthritis. Symptoms often develop in early adulthood between the ages of 20 and 40, caused by inflammation of different parts of the body. For instance, inflammation in the spine can lead to lower back pain and may cause you difficulty when you bend. The joints in the hands and feet become painful, stiff and swollen, and you may find it difficult doing things like writing, getting dressed or picking things up. Inflammation around the Achilles tendon can cause pain in the heel. Inflammation around the breastbone can cause chest pain and tenderness when you breathe deeply. However, eye inflammation and skin rashes that cause pain and redness are common. Even though the conditions are similar and sometimes overlap, there are some features that are specific to each disease. Ankylosing spondylitis, also known as axial spondyloarthropathy, is the most common condition, usually affecting young men. It particularly affects the spine, causing pain and stiffness in the back. Over time, the spine may change shape. In a quarter of patients with this condition, the spine can fuse, leading to a loss of flexibility. Psoriasis is a skin condition causing dry, scaly skin. It commonly occurs over the elbows and knees, but patches can occur almost anywhere on the body. About 10% of people with psoriasis develop psoriatic arthritis. Psoriatic arthritis can damage the small joints of the hands and feet, as well as large joints, such as the knees. It might lead to deformities of the fingers and toes, as well as swelling of joints, causing pain and stiffness. Reactive arthritis, sometimes known as writer's disease, is a type of arthritis that develops a few weeks after an infection. It usually affects younger adults and causes arthritis of the knees, ankles and feet, as well as skin rashes and eye infections. Reactive arthritis will resolve in 90% of people. However, the symptoms usually last for 3 to 6 months, or sometimes they could continue for over a year. Enteropathic arthritis occurs in people who have a diagnosis of inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. They may find that their joints become more painful when their bowel symptoms get worse. If your GP thinks you have any of these types of spondyloarthropathy, he or she may refer you to a rheumatologist. The rheumatologist will ask many questions about your joints before examining you. They may need to do some blood tests and x-rays to confirm your diagnosis. Unfortunately, there is no cure for any of these conditions. Instead, treatment is aimed at improving your symptoms. With the new drugs we have available, symptoms can be very well controlled, helping you to live a normal life. The exact treatment of your condition will depend on your diagnosis and the severity of your symptoms, but the general principles remain the same. In all of these conditions, it's important to keep active. In particular, stretching exercises can help ease your pain and stiffness. Swimming and hydrotherapy are also beneficial. A physiotherapist will give you advice about the different exercises you could try. An occupational therapist will assist with mobility issues at home, as well as your daily activities. Long-acting anti-inflammatory medications, such as naproxen and diclofenac, reduce the swelling and pain in your joints. They must always be taken with food to reduce the risk of side effects. Disease-modifying drugs, or DMARDs, work very well for many people. They are a group of powerful medications that reduce inflammation in joints. Some people who have a more severe disease need biologic drugs. Your doctor will speak to you in detail about the best option for you. Occasionally, if your joint disease becomes very severe and prevents you from living a normal life, a joint replacement operation may be considered. Your condition may suddenly get worse at various times. This is called a flare-up, and often happens when you are stressed or have another illness, such as a cough or a cold. The majority of people diagnosed with spondyloarthropathy will have the condition for life. However, for most people, symptoms can be controlled and improved with treatment. Your rheumatologist will give you a plan so you know which medications to take when this happens. If you have any questions, please speak to your GP or rheumatologist.